Hi, everyone. As you're coming in from the waiting room, welcome, welcome. We've got quite a number of people signed up for this session. We're very excited to welcome everybody. Let's see who else we have coming in from the waiting room for about one more minute, and then we're going to jump right in. I hope everyone has been having a great experience, probably attending other events, other sessions for the CSW forum this year. It's been a really exciting couple weeks. We've got a number of folks coming in as we get started, but yeah, I wanted to welcome everybody to our session, Creating Digital Solutions for Social and Behavior Change, a HPV vaccination case study in Nigeria. Just briefly to say hello, my name is Lindsay Dakin, and I am the product director with Amplio. I've been with Amplio for a number of years. My history is more on the program side, program management and supporting our partnerships. And then a little over a year ago, transitioned over onto the product side to help lead our product development. So really excited to share with you about some of the solutions, the digital solutions that Amplio has been developing. I'm also joined by Elizabeth Ekpewe. Do you want to say hello and introduce yourself briefly?
Hello, everyone. Great to be here. Um, it's nice to have all of you around. And my name is Elizabeth Akpewe. I'm a social behavior change professional, and have had interest working with women and youth in Nigeria, working in the conflict resolution space, working in the health sector, as well as migration and trafficking in persons. And so it's really been an interesting journey, exploring digital solutions that could make our work easier. And so it'd be nice to be speaking with every one of you today. And so that's it for now.
Thanks,
Thank you and
Elizabeth.
welcome.
Yeah, really excited for this conversation we're going to have. So just to take a quick look at our agenda, our sort of plan for this session, for our time together. We're actually going to be using Mentimeter for a little bit for some portions, which I'll introduce more in a second, but we have a brief warm up for us to kind of share some thoughts, share some ideas around these issues as we get started. And then I'll do a brief presentation on Amplio and the digital solutions that we offer, particularly the SBC Impact Designer software that we've been developing. So I'll give you an overview of who we are and what we do. And then we'll bring Elizabeth into the conversation. We'll have some dialogue about how the work that she does in Nigeria and how she's been thinking about how digital tools can apply in the spaces that she's working in. And then we'll, in the last half an hour or so, have some audience Q&A and discussion, and really welcoming all of your engagement, your questions on these topics as well. So just to get us started on Mentimeter. Oh, and I never said, feel free to introduce yourselves in the chat. Again, we'll have some interaction throughout this session and some time for you all to share your ideas and your thoughts, your background, your experience on this as well. And so, yeah, we'd just love to hear and love for you guys to have a chance to know who's in the room with you. So yeah, say hello, introduce yourself in the chat. We're curious where you're located, where you're coming from around the world, and also just, what kind of work that you do, what sector do you work in, etc. So actually with that, that's one of our first warm-up Mentimeter questions. So to access Mentimeter, you can, if you're on your computer, go to menti.com and put in this code, this presentation session code. If you have your phone, you can also use this QR code. and it will take you to the link to access the Menti presentation also. So if you have the chance, the ability to go over to Mentimeter, please do so now. If you can't get out to Mentimeter, you can also participate in the chat, and we'll be doing our best to pay attention in the Zoom chat as well. So just to kind of make sure that we've all made it over to Mentimeter and again, sort of learn a little bit more about who's in the room. Our first question for you to respond to is, what sector do you mainly work in? I imagine from CSW, we might have a number of folks in the gender and social inclusion space, but yeah, and I know many of us might be working across sectors, across multiple sectors. So maybe just pick the one that that you might work in mainly, or that maybe is nearest and dearest to your heart. I know we all maybe play favorites. So yeah, looks like we've got folks coming in from health. That's not a surprise. Maybe the HPV topic caught your attention, and we will be using that as our main example to kind of, you know, follow our conversation. Vaccination uptake is our central case study here, so we will be speaking a lot about that, issues related to that. Gender and social inclusion, WASH, education. All right, looks like we've got a few people in the Mentimeter space. If you're just joining as well, and this should be true as we go throughout the presentation, at the top of the slide, you can see that you can access the Mentimeter presentation, what we're doing here. Go to menti.com and put in this code. So hopefully you all are able to join us, even if you've come in the last minute or so. All right, education too. A few more folks from education that have responded. Great. All right, moving on a little bit. Again, just to get kind of the juices flowing, let's start to think about this case study. So put yourself in let's say Elizabeth's shoes, in the shoes of the team that she's been working on. You know, think about, okay, you're tasked with designing a strategy to increase uptake of the HPV vaccine. So again, little empathy kind of exercise. In the shoes of the folks working on this, imagine, how will you get started? What maybe do you need to know? What kind of information might you need to gather? Or what sort of initial steps would you take as you're starting to approach, okay, how am I going to start to put together this strategy around vaccination uptake for HPV? You can start to put some thoughts up in Mentimeter, or again, if you're not in Mentimeter, feel free to put some thoughts in the chat, or even if you're feeling bold, we ask that maybe you raise your hand. But yeah, if you want to share some thoughts live with all of us, we welcome that as well. So again, think about, you're on this project team, you're tasked with developing a strategy for increasing the uptake of the HPV vaccine. What are just some of the first things that you would take into account? What do you need to know? How would you get started? What might be the first steps that you might take? Great. So formative research with end users and other stakeholders to understand barriers and facilitators and the best way to reach people. Spot on. Don't know who that came from, but obviously I imagine we have a number of SBC experts in the room, that you can all even speak from your experience. Current challenges, understanding current challenges and concerns. What is even the current uptake? What have other organizations achieved? What's worked in the past? So identifying, some of this information you're going to need to gather, identify user needs, info on potential beneficiaries, knowledge about HPV and perception. So a lot of this is, again, around formative research and understanding who are you trying to reach, trying to target, so to speak, and what are their needs, what are their concerns, what are their challenges, what are their current practices, etc. So for sure. We'll move on. What is maybe, in your experience, the biggest challenge in developing an SBC strategy? What's hard about this work? And maybe particularly continuing to think about this HPV example, but even more broadly, just if you're trying to do social and behavior change work, what's hard about it? What are the biggest challenges? I see some more people coming in from the waiting room and some more introductions in the chat. Love to see it. And thanks, Leanne, for sharing the link to the Mentimeter session. Again, if you're just joining us, welcome. And we are spending a little bit of time on Mentimeter for this session. You can see at the top of the slide here, the access information. You can go to menti.com and then just put in this 8-digit code to join us. Yeah, I see a hand. Idrissa, I don't know if I'm saying that right. I apologize, but do you want to say something?
Yes, okay. Let me message it right away in the chat box.
Yes, please. I'm seeing some contributions coming in from Mentimeter on this. Resource limitations and limitations on time, and also what data might be available for your specific context. Absolutely. Bringing in the voices of folks that you're working with, stakeholders, stakeholder engagement. And I like this, breaking away from what is considered the norm. I'm curious, I don't know if whoever made that comment, if you might want to say more about this breaking away from the norm idea, but yeah, I think that's interesting. Idrissa, yeah, I see your comment in the chat. The communities that you want to share message with, their perceptions about the social issue at hand. Definitely, definitely very important to understand. Oh yeah, and I think I see your comment on Mentimeter as well. Important to understand, but yeah, not always easy to get that information. You know, what are truly their perceptions and their attitudes about this? Maybe getting to the heart of the truth, so to speak. Coordinating with multiple stakeholders, absolutely. Yeah. Does anybody, I don't want to put you on the spot, but this person that made the comment about breaking away from the norm, do you want to say a couple of things about that? All right. So great thoughts, ideas. Thanks. So this was just to get us to start to think about, okay, what do we face, when we try to approach this kind of work? I'm going to jump in now to a bit of presentation, and then we'll have a lot more time for interaction in the second half of this session. But yeah, I wanted to share some background about Amplio, who we are and what we do, and then also more specifically the SBC Impact Designer software solution that we've developed more recently and are currently testing. Just to kind of close the loop on some of the discussion that we were just having and give us maybe a little bit of foundation for what are we talking about when we're talking about social and behavior change work? What is that? It's often hard to describe, honestly. I think folks working in this space, would definitely agree that social and behavior change is incredibly complex, incredibly challenging to work in this space, to move in this space, to try to understand how do we influence people's behaviors, encourage people to change their behavior or take up new behaviors. It's again, a very complex process. Lots and lots of resources and frameworks out there for how to approach it. A lot of great research and evidence-based kind of, best practices that have been established. A really wide variety of approaches that you can take, which is maybe one of the other challenges as well, is parsing all of that and understanding, how should you approach this work? But a lot of those things have maybe common building blocks, certain elements that are common to most of those approaches. We've done a pretty good literature review of all the different resources that are out there in the development of this product and this work that we've been doing the past few years. One framework that I've landed on that I really, really like is this Designing for Behavior Change framework that was developed by USAID. I think it's fairly simple. And I think, again, it's got at least all of those main major building blocks, main components of what it takes to do social and behavior change work. But again, I'm not saying that this is the framework or the way to do it. It's just one example of a process that I personally like. And we can talk more about some of those challenges and parsing those different frameworks in our discussion too. But yeah, I think, at least the common elements of approaching social behavior change work. First, of course, you're defining, you're identifying what is the behavior that you're trying to influence. In many ways, that's akin to defining your objectives for your project. In this case, following the case study example that we're talking about, it might be that girls and potentially boys, I know it's often girls that are targeted, but boys are in there as well. Girls and boys age 9 to 14 get vaccinated against HPV. That's the behavior that we want to achieve, right? And then from that, as a lot of you raised in some of those initial ideas in the warm-up, we're trying to understand, okay, who are those audiences? Who are we needing to talk to influence this behavior? Maybe primary audiences, the folks that are going to change their behavior to take up the behavior that you're targeting. And then maybe secondary influencer audiences who might have an influence on those primary audiences that you want to see take up the behavior that you might also need to talk about. So in this case, our audiences might be mothers and fathers of girls and boys age 9 to 14, or, extended family members. We can also identify all sorts of other audiences that might be included as well. But maybe the primary one might be those immediate family members. And then from that, again, as we also sort of started to say, we really need to understand those audiences, right? Who are they? What are their lives like on a day-to-day basis? And what drives their behaviors, and what barriers do they face maybe in trying to take up the behavior that you want to encourage? So in this case, we might understand that, okay, mothers and fathers of these adolescent girls and boys, of course, they want to do what's best for their children, but maybe they face a lot of barriers in accessing the services and the resources that they need to access this vaccination. So now here's where I think it gets a little sticky is, okay, you've done all this research, formative research, you've come to a great understanding of, what behaviors you're targeting and who the audiences are that need to be involved, and understanding what are the needs and concerns and resources available to those audiences. And now we need to turn that into an intervention, a plan of action or a theory of change, or however you might think about it. But yeah, what do you then do with all of that formative research and that understanding that you've come to? In the Designing for Behavior Change framework, they kind of, I always think this is a little kind of abstract, but they call it bridges to activities. So in this case, if we say that a barrier is that, they don't have the access that they need, okay, we want to think about how to decrease those access barriers. And that's how we start to turn that into action that we can take and an intervention that we can design. This is, of course, a simple example. So, the intervention we might do is to, okay, increase resources to health workers, or figure out how to make vaccination, easier, cheaper to access. That in itself, of course, is a task, but maybe a little bit more straightforward, pathway towards seeing what that intervention might be. If we're talking about a barrier that is around a social norm, a sticky social norm, that's not always super straightforward, of course, is how to figure out what activities, what are you going to do to actually, address a maybe more complex social norm type barrier. But yeah, this is again, the main idea is that from your understanding of your audiences, you're going to start to design interventions that are going to start to address that. But again, it can get much more complex from there. And looking forward to more comments from the folks in the room from your experience about, the nuances of this process. So through all that, so Amplio recognized that, again, the social and behavior change process is complex, is sticky. There's a lot of resources out there, but they can be hard to parse, hard to digest, hard to figure out how do they apply practically in my situation for the work that I'm trying to do. And then on the other side, project teams have limited bandwidth. They maybe have limited SBC expertise. They don't have a lot of background in these kind of ideas. And so again, it's hard for project teams to kind of figure out, where do you start? Where do you go from here? But social and behavior change, these ideas and these practices are really core to achieving development objectives, right? I think Amplio and many people would say that social and behavior change is a core aspect of probably virtually any international development intervention. And so I think trying to find a way to mainstream these ideas into all of our project design across different sectors would ultimately be very valuable, is an assumption, is a hypothesis that we have, but maybe a lot of people would agree. So what we wanted to do is design a digital solution to help people achieve that. So the SBC Impact Designer software, the goal of it was to enable organizations, governments, communities to effectively co-design, monitor, and evaluate their SBC programs, leveraging the best practices and frameworks available. So, right, how can we help projects to more effectively, more efficiently take advantage of the resources that are out there and incorporate those into their SBC project design work? Okay, this is a brief video. Let me do a quick time check. A brief video that gives a nice overview of what we're trying to achieve with this SBC Impact Designer software. So let's take a couple minutes just to look at this.
Social and behavior change is a critical component of every development program, but it's not always easy to achieve. Imagine a digital tool where you, as an SBC practitioner, have one place for a library of expertise at your fingertips. Organized project management and connected collaboration. It's time to stop imagining. Introducing SBC Impact Designer, an open source software platform that provides you with customized SBC guidance. Intuitive project management features help you translate theory into accountable action. Most importantly, designed for collaboration with communities and other stakeholders. No more sorting through hundreds of pages of theory and case studies. SBC Impact Designer gives you just the information you need and the guidance to manage your project at every step. SBC Impact Designer identifies potential issues before they arise. It ensures local insights drive the program and helps you see your project through the eyes of the communities you serve, empowering you to create change. Partner with us to create the world's first comprehensive SBC digital platform at amplio.org/SBC.
Great. So those are big goals. Those are big promises. And yeah, still, we'll talk more about the development of this platform and the current testing process. But yeah, I think a really ambitious vision that we're trying to achieve for partners around the world. So why Amplio? Who is Amplio? What do we do? Why are we playing in this space? Amplio has been around for over 16 years. Working in the social and behavior change space, we develop and provide digital solutions for SBC. So far, we've had partnerships in 14 countries, mainly in Sub-Saharan Africa, although a few exceptions in South Asia and the Caribbean, reaching over 2 million people and counting so far. And we've done this, we've achieved these things mainly through our flagship technology, the Amplio Talking Book. So the Amplio Talking Book, we developed, again, about 15 years ago, developed actually in partnership with communities in Ghana. The Talking Book is an easy-to-use audio device that shares audio content on demand in local languages and is really geared to reaching the hardest to reach communities, the folks that otherwise have really limited access to other kinds of information and communications technologies. So talking books kind of help bridge that gap, bridge that digital divide, so to speak, and put information and messaging into the hands of these kind of remote off-grid communities in a way that is accessible and friendly and easy for them to use. And again, in local languages, which is key. The other thing that talking books can help can do for you is that they collect some great data for you to get some insights on those communities and what their priorities are, what their needs are, what their feedback is, etc. So the talking books collect quantitative usage stats on just how much is each talking book being listened to, how many times is each message on the talking book played, so you can get some great insights on your communities in that way. But then also, I think this is one of the more powerful features of the talking book is that it also allows users to record onto the devices their own messages, maybe a question or a comment or a story or a piece of feedback for the project. So it really is that more two-way communications device that, yes, you can load messages and information onto it that people can listen to and learn from, but then you can also gather people's perspectives, gather people's voices from the community level, from the field, and bring that back to your project team or your other stakeholders, really listen and learn from what folks are saying on the ground. So yeah, that's just a little quick summary of talking books, and we can talk more about talking books if anybody's interested in that. But in terms of the origin story of, okay, how did we come to now develop this SBC Impact Designer software? Yeah, it really came out of us coming to an understanding, a realization of, okay, the talking books are in many ways only as impactful as the quality of the content and the messages that goes on to them, obviously. And so over the years, we do a lot of work with our talking book partners to work with them to develop really effective messages that are going to go onto the talking book platform. And we wanted to originally find a solution to, support partners in that maybe a little bit more efficiently, effectively. We wanted to find a solution to help partners, themselves design really effective messaging and content for the talking book platform. And then the idea grew from there. We're like, well, why can't we maybe apply this platform as well to other projects that might need support to develop really effective social and behavior change strategies that may or may not include the talking book as a communications channel. So that's kind of where we were coming from the development of this product. And so a few years ago, we had some initial ideas about it and then, started developing it in earnest a couple years ago. And then this year we've been testing. We've been in a testing phase. Right, a little bit more about what the software can offer. So again, recognizing that there's a lot of great resources, a lot of tools that are out there. This is a screenshot of the UNICEF Behavioral Drivers Model, which is an amazing, really evidence-based framework that UNICEF put together, really kind of cataloging and categorizing all of these different factors that influence people's behavior, very much rooted in behavioral science. So in many ways, can be very academic, very kind of hard to understand, again, how it might apply in practice in your work. And so, right, we wanted to maybe develop a digital solution that would help to make a tool like that more digestible, easier to browse, easier to understand what applies to your project, highlight that. And then also leverage AI technology, artificial intelligence, to help you to maybe digest and weed through those resources as well. So in this case, with the UNICEF behavioral drivers elements that we've incorporated, the AI can help you understand, okay, based on what we know about your project and what you're trying to achieve and who your target audiences are and what are some of the root cause analysis, the formative research that you've gathered, the AI can help you identify, okay, here's the top 5 of these behavioral drivers that we think that it thinks that, try not to personify the AI, but that the AI has generated to at least help you sort of focus in on what might be most relevant for you and your work. There's other ways that we've incorporated AI into the platform throughout. You see these little light bulb icons where you can get the AI to generate some suggestions for you, whether maybe you're developing some message key points, some points or a script for a message that you're wanting to target to one of your audiences, or you're doing some root cause analysis of your problem statement. So yeah, there are ways that we've incorporated AI throughout the platform to help you at least generate some initial ideas, some initial suggestions. We're very aware of some of the risks and limitations involved with AI, which we would love to talk with you more about in the discussion part of the session. We can say a lot more about the AI potential and pitfalls, risks, but yeah, we recognize that especially in these really context specific situations that the AI definitely has limitations. So we're trying to treat it as, here are some initial ideas, some initial suggestions that then you can build off of, and you get away from that sort of the scary blank page, right? Starting with like 0, starting with nothing. Where do I start? The AI at least maybe gives you some place to start. But yeah, definitely would love to talk more about our experience with AI here. The other thing that we've incorporated into the platform, which I think some of you raised in those initial sort of warm-up questions, is how can we use a digital solution to make this process more collaborative? So both within your project team, like within an internal team, how can you keep everybody on the same page, share information about a project, everybody can contribute to different elements, just have, one place where the team can all access and develop this project strategy. But then also, how can you effectively engage external stakeholders, external folks, and bring their voices into the process a little bit more, maybe consistently? So rather than maybe just an initial consultation session at the start of the process, how can you engage them in an ongoing way throughout the process? So the way we've done that on the platform is to integrate WhatsApp, that you can have a set of contacts that are associated with your project, whether it's, again, your internal team that you want to just kind of send out quick WhatsApp updates about new developments on the project in the platform. Maybe some of your team is in the field, they can't log in on their computer and log into the software, so at least you can share, hey, I worked on this, what do you think? Or again, those external folks, a set of contacts that you want to share some information, some updates about the project, and then even they can respond directly in WhatsApp when they get those messages, and you get kind of a message feed in the software of, some of the input, some of the feedback that you might have gotten that you can then incorporate into the design. So yeah, that's a way that we've integrated into the software, a way to sort of communicate and broadcast out some of this project information. So yeah, the software, we imagine that we're going to use it for a lot for strategy design, putting together your communication strategy and messaging, and then monitoring and reporting, understanding how is the project going, what are some of the initial results or feedback that we're getting, and how can that then, close the feedback loop and inform your ongoing strategy. So yeah, we've really designed the platform to help sort of support you throughout the project cycle, but honestly, a lot of it is built around that upfront strategy design, is really at this point where this software is, I think, adding a lot of value. But that's the question that we're exploring right now in this testing phase. So currently, this software platform is not yet available, open to the public. We are beta testing this year with about 15 partners that we've identified. And yeah, we're trying to explore what is the value that a digital solution like this can have for the SBC process, And how is this software going to now apply in, real world projects across all different sectors? In our development of the product, we've gotten a good understanding of what the needs are out there, but now we really have a chance to, okay, apply it in the real world and see maybe what the ongoing needs are. And then what are the challenges? What are the barriers? Again, as we talked about, what are some of the risks to introducing a digital tool like this? So one of the partners that we've been working with is my friend and colleague, Elizabeth. And so now I'd like to bring her into the conversation. And yeah, we'll talk with Elizabeth more about what her work is, what her experience has been, and some of the ideas that she has about how digital tools can apply in this SBC work. So hi, Elizabeth.
Hi, Lindsay. Thank you so much. And that was such a good presentation and well done.
Thank you
So,
very much.
this is Elizabeth, and I've been working with Lindsay and the team in testing. I like to say playing with these toys, and then testing how it will make my work easier. So it's been over a decade for me working on real life projects and trying to get real life solutions. I mean, most of you here who have been in the development space, we know how we all started as communication for development professionals. And so it was all about IEC materials and jingles and just messages and generic messages and all of that. And then the interesting transition after some years to social behavior change communication. And then we finally realized it's not all about communication tools, it's about a little bit of more empathy, working with the people concerned, the people involved. And so it's really interesting my attention was drawn to how exciting it will be to have an AI buddy or a tool that will make this process more scientific, um, and then make it a bit easier and help you think through the process and maybe have something that can be standardized. So it's really interesting working on this project. And I mean, the journey has been, working on really complex projects in really complex terrains. For instance, well, the case study today is on the human papilloma virus vaccine that's been introduced for girls aged between 9 to 14 years. And this adolescent category it's a new ground for the country, and it's really exciting. So that's the kind of complexity we're working with, where you have a broad spectrum of stakeholders. From the Menti feedback, you have people saying, hey, the first thing you want to do is map stakeholders. And then you map and then you stumble on government stakeholders and other partners and individuals and community structures. And so that has resonated through my work in conflict areas, where you have to work in conflicts, post-conflict and conflict terrains, when you're working with integrating ex-combatants. So some of your stakeholders are maybe very destructive, but you have to engage. So that's how complex some of the real life issues and situations can be. Or you have stakeholders in the trafficking space, and you have to contend with maybe repentant traffickers or something, and and trying to see how you can go through the network and make things better. And then as complex as the HPV thing, where you're dealing with a new cohort and you're introducing a new vaccine, and you have to contend with so much cultural diversity and all of that. And then going to the response on Mentimeter about what are the challenges you face in the process of doing your SBC work. For me, it's been an array of challenges, really. And then I like the response about breaking from the norms, where the mindset is it's still about communication for development. I mean, it's just about, hey, I sit on my laptop and I guess, and I think I know what messages I should send out to people. And so getting people, so the challenges are both within organizations, outside organizations, with practitioners, with the community. So it's a whole array of challenges. As many stakeholders you map come with as many challenges as you can find. So it's really interesting. And so it's another challenge that I have stumbled on is beyond the assumptions, people beyond the mindset and the way of doing things. So that brings us to beginning to develop the culture, of having formative research. It's expensive. A lot of people feel it's expensive in terms of time and resources. And, people just want to jump in with the intervention. And so you need to take out time to have maybe a gender analysis, maybe formative research, beyond the desk review and beyond knowing how did other people do it. You also want to have a contextual insight on the people that are going to benefit from the intervention. And that for practitioners has been, I think it's an emerging culture. It's a culture we're going to have to advocate. Like, let's understand the terrain, understand the people, understand the way, what they feel. So, I mean, it can go as expensive as a formative research or some form of qualitative, quantitative analysis, and it could be as cheap as a rapid survey. But then that interface with beneficiaries and target audience, I think that's one of the biggest barriers we will need to surmount as practitioners. And I mean, testing the SBC app, the first thing it tries to make sure you have baseline information. And so I think the beautiful thing is the app takes your hand through the process and says, hey, and then you're stuck. You don't have baseline information, you can't move on to the next stage, and which is what the entire process, within the complexity of real life situations. I mean, I think the app takes us through the stages we should think through in developing social behavior interventions. If we can get it right, talk to the communities, talk to the beneficiaries, the target audience, get to understand what they feel and how they feel, their knowledge, attitudes, perceptions regarding the intervention. I think it will go a long way in understanding the barriers they face in enjoying whatever good thing we feel we wanted to provide for them. Is it vaccines? Is it communication strategies, or whatever we thought would be beneficial to the community? It's important to engage them. And not just engaging them at the beginning of the process. I mean, taking them through the entire process, testing everything. I think Lindsay mentioned something about having a kind of collaborative session where you take people within the organization, outside the organization, different stakeholders, and then have an opportunity to also engage people who have not been involved in the process, so that's one interesting part. But then we also have the stumbling block of having people who were supposed to be enablers or supporters of your initiative becoming barriers. And you see that a lot in the health space, where maybe frontline health workers don't understand what you're talking about in terms of introducing a product. And then if you're not careful, they become barriers and obstacles to the entire process. And you see them as trusted sources, and then major influencers of the entire process. The same thing applies to other sectors like my experience in smuggling of migrants, trafficking in persons, where you have most times interests from maybe partner organizations who are only interested in returnees and getting returnees back into the cities. And then their interest is not about plugging the hole of getting people out of the country illegally. So that's like a scenario where, I mean, the interest of that stakeholder is not the stakeholder wants to keep the traffic coming in some kind of scenarios where you see barriers in the course of your work. So you ask yourself, whose behavior are you trying to change? And some of those can be really subtle. And then I like the fact that the SBC app takes you through the process of really understanding the behavioral, the mindsets and what people are thinking, how they are behaving, their interests and all of that. And then when you go through that mapping and you're able to think through, and it's not easy peasy, it's not a breeze, it's I mean, even just testing the app and trying to develop a communication strategy, it's been like thought-provoking. I mean, you sit down for days, and Lindsay and I have gone back and forth, and like, how does this work? How do you think through all of this? How do you navigate the complexities of developing theories of change and all of that? But then the app puts everything in perspective. And so that's really, really interesting. But then another issue is if we are interfacing or we're connecting with artificial intelligence, I always say it's like a puppy. You have to train AI to give you what you want. And so it's important to have as many professionals get on board, hands-on, test it out, find out. And then the more AI engages, the more it gets better. And I think with more questions from the audience, I think I'll be able to elaborate on other areas of interest. But for now, I'd like to turn over to Lindsay
Thanks,
if you need any
Elizabeth.
clarifications. Yeah.
I just maybe
Thank you.
I have maybe a couple follow-up questions for you, if that's all right.
Uh-huh.
We can go back and forth a little bit.
All right.
I'm curious maybe to hear more about, so like from your experience working in this space and some of the formative research that you've been involved in, some of the research projects that you've done, what are the opportunities for, right, what role digital technologies can play in the SBC process? Aside, you've talked about a bit how the app is helping you, maybe think through the strategy, the theory of change and the communications, etc. But yeah, what are some of the other ways that digital technology can be applied in this SBC work?
If you start from formative research, I mean, there's so much, a tool like the talking book you mentioned in your presentation. I mean, a tool like that has the capacity to provide two-way communication between communities. And I mean, I've been fascinated by the usage over the years, and I know you've tested the talking books in other countries. And it's interesting to know that having a device that could record messages, can be questions, it can be messages in your local language. I think that's really the ultimate, really, in communication. For instance, I've had to do focus group discussions with community members in trying to develop the communication strategy. And I find myself, well, you're coordinating a nationwide strategy, SBC strategy, and then you have targeted locations, and you have to repeat this process in different locations. And I mean, a digital tool like the Talking Book could standardize your work. I mean, you could have assistants take Talking Books to different locations and have standardized questions translated into the local languages. And I mean, that saves cost on translators and travel for multiple personnel and all of that. And imagine the real time, how you get feedback in real time from the back end of the Talking Book. That's amazing for a practitioner. And I just wish I had that tool then. It would have made my work so easy, like accessing focus group discussion, key informant interviews in different remote regions. Not to mention conflicts within locations where most times you have travel restrictions and security compromise areas hard to reach, so I mean, it has that potential of making your research much easier. And then I think the adaptability of that tool, is interesting. It's something we should explore, especially now we want to entrench and advocate for a culture of formative researches, baseline researches before interventions. And then, I mean, beyond the research, I think it's fantastic. I've had to support remote communities and where I don't understand the language, and you have to talk, you have to have town hall meetings and community dialogues. You want to set the agenda on issues, and you want to have consistent messaging. I mean, this looks so portable. I've had situations where I had to carry a TV set, a projector, a generating device, and move in the car and across 10 locations just to get the message consistently across. And this is so handy and so portable. And I think it has that potential, really. It has that potential. And I mean, it could be explored in terms of the emerging approach of integrating services. I mean, I can imagine a tool that could have you talk about things in conflict, in migration, in health issues, several health issues at the same time. And then the issues of gender access, equitable access to information, which is one of the barriers experienced in the health space, where you have cultural restrictions to women accessing services. And so they depend on the information of the householder, the head of the household. And so if he says, whatever he says is right. But then if you can engage this, if you can engage with men, boys, women, and they have the same kind of information, I mean, I think decision-making will be easier in terms of equitable access to, say, healthcare and health services. So that's a great potential. And then, I mean, the issue of having rumors being one of the barriers, the major barriers in vaccination space, where you have anti-vaxxers from another continent. And then, I mean, in a world of internet where you just watch a video on your WhatsApp or the social media, you get to hear the rumors directly from the communities. And I mean, and the anonymous nature of the feedback makes it easy for women to be able to say this in their focus groups discussion without feeling threatened, So it really has that potential. And there's a lot of potential for generating behavioral insights where you begin to gauge the behaviors of your target audience periodically to assess entry points for your interventions. For the health sector, we have issues on the demand side as well as the supply side. So you see where you want to ensure that the capacity of your personnel is optimal in the sense that they have consistent information and they have the right information to, since they are trusted sources, they have the right information to give out. So I mean, even the talking book, if we explore it further, has the potential of being a good teaching aid, you know. I mean, in terms of having, it's been tested in remote areas, and I'm so sure and I'm hopeful that um, we could also explore it as a teaching aid, a job aid for health workers in very remote areas. Social listening is another opportunity. But I mean, overall, in simple terms, being able to talk to the people who have the challenges and designing interventions that are adapted, contextualized, and are really solving the people's problems beyond the interest of organizations. Thank you, Lindsay. I hope I was clear.
Of course, thank you so much, Elizabeth, for your comments. Maybe so if I can prod you one more time, Elizabeth, before we go to audience questions. I think, yeah, we've talked a lot about, opportunities, the potential of these digital solutions for SBC work. And I think maybe you touched on a couple of these in your comments, but what are some of the potential risks or challenges or barriers that we need to be aware of when we're introducing these digital tools? What are some of the pitfalls that we need to be careful to maybe avoid when we're introducing these things?
Yeah, it could be tricky. I mean, in the real world today, some people they even find it difficult to send text messages. They're just so scared of the telephones, you know. So I think one of the things I have identified so far is the risk of um, you know, I'm a data analyst, and I understand this professional pride of showing off what you think you know. So so sometimes you feel from your end, this is the answer the world needs, and this is all um this is the solution. But I think um the advantage of having a tool that gives opportunity for people to interact. For instance, you have uncensored, uncontrolled feedback on the talking book, and you can imagine what people can say. You never expect what people will say, and then I mean, one of the principles of our SBC work is to ensure um, interventions complement what's already on ground and is not disruptive. And, at the end of the day, development professionals, we want to leave the communities better than the way we met them. But then the fear a lot of people have is internet connectivity. Can we maintain the devices? I mean, just the experience as a communication professional where you give out megaphones to community workers. I mean, it's such an uphill task to even get the batteries. I mean, having the batteries running on those devices. So that's one of the challenges we've stumbled on having. There were even times we had to have interventions that make the messages consistent because when you have a megaphone and maybe a town announcer takes the megaphone and just goes on a walk around the town, he could say anything he wants. But then we had to move to having memory cards with pre-recorded messages in the local languages installed on the megaphones. And so that was able to standardize messages in communities and get people interested. especially when people hear messages in their local dialect. So I think the antidote to the fears will be to ensure that there is community ownership in using digital tools. Well, I think this applies mostly to the talking book, where if it really, if you can talk to the people and the people really, you can listen to their needs and it helps you understand the people, I think that's the best thing that a digital tool can do, beyond just showing off that you're innovative, because that's another part of it. You want to show that you're innovative and you're making your process easier, but who are you making the process easier for? Is it the practitioner or is it the target audience, the beneficiaries of your intervention? So that's the balance between digital innovative interventions. I mean, so as long as it makes life easier for people in the communities, I think that's the best thing we can have. I mean, telephones made life easier. What do you think?
Absolutely, Elizabeth. Thanks so much for those insights. Yeah, I really like where you landed about, we need to keep our eyes on the prize, so to speak, and make sure that what we're doing is yeah, again, making life easier, making life better for these end users in product development language, or yeah, program participants, folks at the community level. Yeah, I love that. Well, okay, with that, let's open it up to questions from the audience with us. Yeah, please feel free to put your questions in the chat, or if there's something you want to say or ask live, feel free to raise your hand and we can make that happen as well. So I see a question already from Raul, who's saying, how do you proceed to make your digital contents trustworthy, as the target might receive it among other infodemic content? So, right, how are we ensuring kind of the quality of the messaging that's going out, and making sure that people are trusting this information in, yeah, as we know, an environment where there's maybe a lot of misinformation these days. Elizabeth, do you have any comments on that?
In terms of making your digital content trustworthy for audience, it's really two ways from the way I see the question. But the process of keeping in mind that this is about people, and then I think starting off, for instance, the software starts off by you having your formative research, your desk reviews, your background information right, and then we go on to collaborative processes where all the stakeholders contribute to the process. But then when you get to the content, developing messages, I mean, you can't do without testing these messages. I mean, because of course it was developed with the people in mind and with the target audience. But then there's also the part of the SBC process where we take out sample messages, sample jingles, sample flyers, sample texts, and then we want to test it among target audience. And I think for now, and that's been the way to ensure that the messages are right for our audience. So do you have any other response to this, Lindsay?
Yeah, I would definitely agree. I think where you started around, really understanding your audiences, and maybe particularly who are those influencer audiences, who are those existing trusted sources at the community level that you can speak to and kind of try to get your messages out through those channels. For example, I know that for the work that we've done with Talking Book Partners in developing their content, maybe we're also working with them to develop endorsement messages from influencers, so to speak, from leaders within the community that are trusted. So we kind of work through those folks to develop messaging that we're going to get out, or even doing like an interview with somebody who is trusted at the community level, and as much as possible, maybe leveraging yeah, those folks that already have built trust in the community, and working with them to develop messages, or even working with them to deliver the messages themselves. Yeah, I know that that's one strategy that we use on our talking book projects.
That's nice. That's nice.
Yeah, what other questions does anybody have? I don't know. Yeah, Raul, hopefully that answered your question or gave you some insights. Curious to know if you have experience in this realm, and what some of your what your thoughts might be. But yeah, any other questions from anybody in the room?
No question, please. Thanks, Lindsay.
Thank you. Hope you enjoyed the talk, enjoyed the session. Hope you maybe learned something or give you something to think about.
No, really no. Just say thanks for the
Great.
session. The two the session of Elizabeth and the session of Lindsay, you are very quiet to learn, because in SBC Cameroon Society is for learning to adapt in all our programs.
Absolutely.
Thank you very much.
Thank you. Thank you. Any other questions or comments from folks? Well,
I actually do have a question,
yeah.
Maria. So thank you so much, first of all, for your, the very honest reflections and insights. You really got my head spinning, and I find it very, very interesting and inspiring. And I have been working lately on gender responsive and age sensitive programming. I'm wondering to what extent this tool would also be fit for purpose for older people who might be less acquainted with digital tools. So to what extent, or can that be adapted, or perhaps you have some experience working already with older people who may shy away from all the tech that is coming towards them, especially perhaps if they are really placed in very remote areas, and to what extent that may also create a stigma against the tool in itself, and what experience you have overcoming this. Thank you.
Interesting. Great question, Maria. Thanks so much. I love the way that you're thinking, what you're thinking about. Yeah, I can say, at least for Amplio's experience and what the work that we've done with talking book projects and partners over the years. I mean, again, excuse me, little frog in my throat. The talking book itself was designed very intentionally to be kind of very user-friendly, accessible, easy to use for, yeah, a very wide range of users. But I'd say maybe skewing on the range of folks that you're describing, that have maybe had zero interaction with technologies in the past. And so, right, a lot of thought put into the development of the device to make it so that folks could pretty easily pick it up and understand how to use it. For example, on the talking book, we use pretty simple icons like a tree or a hand or a house. I think an original iteration of the device used the more traditional, the more kind of common symbols that we're used to, like forward arrow, backward arrow, 2 lines for pause, you know, those kind of almost geometric shapes that we kind of know what the meaning of these triangles and squares and lines are. But yeah, for folks that haven't interacted with technology before, what is that? So right, that was one thing I think that they learned early on in developing the talking book was, okay, let's use some of these more universally recognizable sort of practical icons as proxies for then giving audio prompts, telling people to, you know, listen to messages on agriculture, press the tree, or to try another subject, press the hand, or to finish recording your feedback, press the star. So right, kind of easier ways to describe, press this, you know, if you want to take an action. So that's yeah, one thing I would say to your question, Maria. And I think we have seen just with experiences, you know, seeing talking books get out into the field. Yeah, I think really beautiful stories about, you know, the older woman in the savings group that, yeah, has never really interacted with technology like this, that yeah, is pretty thrilled, is pretty over the moon with, you know, how she's able to, within the space of like maybe an hour or so, like, you know, maybe not immediately, but with maybe some support from her fellow group members or from the trainer, you know, to really pick up and get the hang of this technology. So I mean, we are conscious of introducing the talking books in a sensitive way that's going to make as many people as possible feel comfortable with the technology. But yeah, that is really core, really central to our approach, I'd say. I mean, so I'm talking a lot about the talking book from Amplio's experience. You know, this discussion is maybe less relevant for the SBC Impact Designer software, because that is a software platform that is more designed specifically for project teams, for project staff, you know, folks that are more on the delivery side, to help make their lives easier a little bit, to Elizabeth's point, maybe less for the end user. But yeah, I think that's one thing that maybe sets Amplio apart a bit, is that we definitely have, you know, those kinds of users specifically in mind, and that's specifically who we're trying to reach. So hope that answers your question, Maria. I don't know if you have any
Yes,
response.
thank you so much. Yes,
Yeah.
definitely.
Any other questions from the folks in the audience? Well, if not, we might wrap up a little bit early. Leanne has shared in the chat. Leanne is my colleague at Amplio. Thanks, Leanne. You may be seen some of my Amplio colleagues as well jumping into the chat. Yeah, my email, feel free to reach out to me directly at lindsay@amplio.org. And Elizabeth has also shared her email, stlizzy60@gmail.com. We welcome any further engagement with you guys on these topics, and especially if you're interested in learning more about the SBC Impact Designer software or talking books. If you want a demo of either of those technologies, I know we didn't really look at them actually in action, and so you can reach out to me if you want to see the technology in action, or just have more of a conversation with me about, you know, here's what you're working on, here's, you know, the project or the sector that you work in, and how might these technologies apply for you and your work. We can have more of that sort of individualized discussion. So yeah, I welcome any communication from you all from this session today. And we'll also be sharing around to everybody who registered for the meeting today the recording of this discussion, and maybe some follow-up resources or information as well. So thank you all so much for your time, for attending today. And yeah, just really pleased with some of the ideas that were shared. So thanks so much.
Thank you. Thank you. Thank you, Elizabeth.
Thank you. Elizabeth, do you want to say
Thank
anything?
you, everyone.
Yeah.
Yes, and
Thank you.
I think Sahu has a comment, but I think I think it connects with how I felt when I was testing out those tools. I mean, it's so great to have an AI buddy help make your work easy. And so for those in remote areas, so far, I think these tools are introduced with the support of our project staff, really. I mean, like, even in using the app, you still have back end phone calls with staff at the back end, guiding you through the complexity of the process. And so I think it's not just throwing a device at anyone or an app at anyone. It's just working with the communities and with the professionals to make their work easier. So thank you, Saho, for the question, and I hope this clarifies. Thank you.
Thanks, Elizabeth. And thank you, Elizabeth, so much for your time and for sharing all of your thoughts today as well. It's always a pleasure to
It's a
connect and
pleasure
work
and
with
an
you
honor
and
too.
hear what you
Thank
have to
you.
say. Thank
Thank
you.
you so much.
All right. Thanks, everyone. Have a great rest of your day. Bye-bye.